everyone, my name is Gonzalo García Casasola. I work at Infanta Cristina University Hospital in Madrid, Spain. I present the next case and I hope you enjoy.
Let's start. I present a 70-year-old male. He has some years ago a high-grade urothelial carcinoma of the gallbladder. The treatment was cystoprostatectomy with neobladder reconstruction, and in the surgery, the urothelial margin was affected. Some years after it, the patient presents a eritematous plaque in the gland surface. The dermatologist did a punch with the diagnosis, which I'm not going to show now, but with that diagnosis, a glandectomy surgery was performed. This is a slide of the surgical biopsy. Here, in this point, we can see the previous biopsy with this scar. Here, the irregular epithelium acanthotic one with this hyperkeratosis here, and the corpus spongiosum that at high magnification we can see the rectal tissue with this specialized venous sinus with fibroconnective interstitial tissue. Okay, let's have a look in this video, the methoxylin and eosin. See epithelial with irregular surface, with hyperparakeratotic and with acantholytic dyskeratotic-like lesions. But if we go to high magnification, we can see the typical cells in the basal layer, in the middle of the epithelium, with big and clear cytoplasm, sometimes organized in nets, and with spread in single cells to the surface of the epithelium, sometimes alone. Not the atypical nucleus and nuclei with this clear and high cytoplasm. Okay, with the methoxylin eosin, the differential diagnosis is with extramammary Paget disease, which it could be primary or secondary. It is also important to exclude squamous cell carcinoma in situ and melanoma in situ. Paget disease is a distinct intraepithelial adenocarcinoma with pagetoid growth pattern. This is classified in two categories, mammary and extramammary. Mammary accounts the 90% of the Paget disease occurring in the nipple and areola. The spread of ductal carcinoma or invasive ductal carcinoma are the most frequent situation. It represents 90%. Extramammary, it is divided in primary and secondary. Primary is classified if it's only intraepithelial, it's classified at 1A, and if it is intraepithelial and invasive, is 1B. And secondary is related and other neoplasms without intraepithelial growth and spread from visceral carcinoma. This is the secondary type, classified as 1C. In the anal region, you have to think about a colorectal carcinoma, and in the genital area, you have to think about urothelial or prostate if it is a male. We did the next immunohistochemistry techniques. S100 and HMB45 was negative and ruled out melanoma. Gross cystic disease fluid protein 15 was negative. This is a sensitive marker for Paget disease, but is more sensitive GATA3. We will see later. And in this case, it is positive. And GATA3 is also positive in urothelial carcinoma. For that, we have to think about, and we are thinking about a secondary Paget disease in relation with the previous urothelial carcinoma. We decided to do these two markers P40 and P63. Let's have a look. CK7 and P40 is dual technique, CK7 in red. In this slide, we see the CK7 immunohistochemistry in the tumoral cells, and P40 is positive in the nucleus of the average keratinocytes. Okay, we can see here the CK7 which is positive in the neoplastic tumoral cells, and P40 is positive in the average nucleus of the keratinocytes. And it is also positive in the nucleus of the tumoral cells. And here we are going to see P63 immunostain. The interpretation of P63 is positive in the nucleus of the neoplastic cells, and we have to go at high magnification because it is also positive in the normal keratinocytes, but we can see here the positivity in the tumoral cells. Okay. With these, with all of these results, our diagnosis was secondary extramammary Paget disease with an underlying urothelial carcinoma with intraepithelial extension. Urothelial carcinoma and primary extramammary Paget disease have in common the positivity for GATA3 and CK7. And the distinction in this case is that we have the positivity for P40 and P63, and it's negative for gross cystic disease fluid protein 15 in the urothelial carcinoma, because this marker is really sensitive in the extramammary Paget disease. I show you this article. This is a really nice one, which speak about GATA3 as a sensitive marker for primary genital extramammary Paget disease, and it compares with gross cystic disease fluid protein 15. But in this article, it also explains the Paget disease in general, and it's a really good one in a very schematic form. Okay, thank you very much. I hope you enjoy the case.